Hi everyone, good evening. Welcome to another session of DogSpot Live. Today we have a very senior vet with 34 years of experience with us, Dr. Morton from Bangalore, who runs the Blue Ridge Vet Clinic over there. And we're very lucky to have him. He has a lot of experience, and we're looking forward to talking to him about preventive healthcare for pets. And we'll also touch a little bit on taking care of pets during monsoons. So, Dr. Morton, good evening. Welcome to DogSpot.
Good evening, everyone. Nice to be on your show.
Thank you. Thank you for taking out the time for us and joining us. Dr. Morton, so if you can tell us a little bit about yourself, and I know you've been a vet for a very, very long time, but how did you decide to become a vet, and how's your experience been so far?
Okay. Why to become a vet? That's the first question.
Yeah.
Always was interested in animals. In fact, we had a mini zoo in the house. And of course, my parents were very upset. I used to pick up all the stray dogs and cats from the road and bring them home. And it was getting a little difficult for them. But I guess it was something that was in me right from the beginning. And I was very clear that I only wanted to be a vet and nothing else. And I worked towards that. And that was finished in 1986 was when I finished. And from then I've been in various industries associated with the veterinary field and focused more on pet practice.
Okay.
Yeah. And
so where is your clinic in Bangalore?
We have two clinics in Bangalore. There's one on the Hennur Road and there's one in Whitefield. The Whitefield clinic is just about to start, but because of the current situation and the lockdowns and all that, we haven't been able to get off the blocks. Should be up and running before the end of this month.
Okay. So, Dr. Morton, what is preventive healthcare for pets, and how do we go about it?
From the beginning in my practice, I always believed that prevention is better than cure. It's a very old adage, and it also has a lot of value to it.
Right.
Prevention is basically to take care of things and see that everything is done in a systematic way so that pets live a nice, comfortable, healthy life, and the owners also, the pet owners, are also comfortable with the way things are going. Basically, preventive healthcare encompasses a whole lot of topics. Because the basic topic, of course, would be vaccination, deworming, parasite control, reproduction, old age problems, aggression, socialization. All these things put together would give you something as preventive healthcare. So wherever you can prevent a problem from happening, and everything would be great.
Right. So the saying that applies to people, prevention is better than cure, I guess applies to pets as well.
Applies to everybody, yes.
Yeah. So let's talk about vaccination. Let's say we get a new puppy at home, and why is vaccination important, and how do we keep a track of it?
Most of the vaccinations for pets, whether it is a dog or a cat or a rabbit, are all vaccinations for viral diseases. Okay. Bacterial diseases we can cure. We've got antibiotics to take care of it. But for viral diseases, there is no cure. So what happens is we have to prevent it. If a viral disease hits, the virus lives in the body for its specific time, does a lot of damage, either kills the pets or damages the pet permanently. So a vaccination is something that you can use to prevent this from happening. There are many vaccines that are available in the market. Okay. For cats and for dogs. For dogs, the most common vaccines it's a combined vaccine. It contains distemper, hepatitis, adenovirus, parvo, parainfluenza, and leptospira. And then you have the rabies, the kennel cough. These are all the vaccines that are there in the program. Whoever your vet is, he'll be able to guide you exactly what kind of a schedule to follow. There's a different schedule for puppies. There's a different schedule for kittens. There's a different schedule for adult animals.
Right. Very common one we hear in puppies specifically is parvovirus. So,
Yes.
how does it happen and how can it be prevented? Because it's fairly fatal in puppies, right?
Parvovirus, basically disease where the puppy goes off feed, has a lot of vomiting, loose motion, lots of blood. Coronavirus also is there, which has similar symptoms. Usually they
Yes.
go together. So prevention is always better. How do they get it?
Yeah.
Mostly by contact. So
Okay.
if you have a good breeder that you buy your puppy from, you shouldn't have a problem. If you buy it from the commercial fly-by-night guys, because of lack of hygiene, you may have these problems coming up. We also have the local street dogs. They shed it in their stool. They're very hardy dogs. So dogs which
Yes.
have recovered from it, they poop all over the roads. So we take our dogs for a walk, they smell it, they get the virus into them, and that's also a way of propagating the disease.
Okay. So, but I've heard like you can take your very young puppy out for walks. What is that age? And mostly because of this parvovirus only that they'll contract it from the ground, like you said.
Through contact, yeah. What my advice would be to anybody who's got a new puppy,
Yeah.
restricted movement within your house or maybe in the basement of your apartment, but not outside till your second vaccination is done. We
Till the
need
second
to
vaccination is done.
allow
Okay.
immunity to build.
Right.
There may be some part of the immunity which is neutralized. Some immunity may get lost due to maternal antibodies. So there's always a series of vaccinations for puppies. We advise people to give 3 shots of the combined vaccines at 3-week intervals. So after the second
Okay.
shot is done, wait for a week for immunity to build up. I think from then
Right.
on, it's to take the puppies out.
Okay, great. So good to know that, Dr. Morton. I'm sure that will be very helpful for new pet parents or people who are considering getting pets.
Mm.
So I wanted to talk to you about internal parasites. What are these and how do dogs get these?
The most common internal parasites are worms. You have
Okay.
tapeworms, you have hookworms, and you have roundworms.
Hmm.
2 ways that dogs can get this transmission. One is when they go out for their walks, they tend to sniff around. At that time, they breathe in the eggs of the worms which have been shed by any other dog that's on the road. And then it goes into the system. First stage larva in the lungs, then a cough. They swallow the next stage, and you've got worms in the intestine. The second and the
Okay.
most common one is intrauterine. If a female dog has not been dewormed while it is pregnant, then there's a very good chance, if it has a worm load, that you'll get puppies, newborn puppies, which have come out with worms in them, which is
Oh, wow. Okay.
pretty common. Yeah. So
So, but
deworming on a
such
regular
young
basis.
puppies, can they be given medicines for deworming, like newborn puppies?
Newborn puppies, we normally advocate deworming. First round on the 3rd week, second round in the 5th week, once every month till the puppy reaches 6 months. And
Right.
thereafter, they've got a choice of doing it once in 3 months or once every month. Different vets have got different recommendations for deworming. You also have something called a heartworm. The general
Okay.
broad spectrum deworming tablet takes care of everything.
Okay. So you don't have to give different tablets for different worms. It's one tablet which
Generally,
will take care of everything. Yeah.
yeah.
Okay.
Difficult
And
worms to dislodge would be the tapeworms. So there's a different schedule for tapeworms. The same
okay.
deworming medicine, but a different schedule for that.
So, but if how do you know that your dog or your cat, for that matter, has worms?
You've
What
got
are
two
the
ways of
symptoms?
finding out. You've got 2 ways of finding out. One is if the worm load is very heavy, you'll see the worms in the stool. The second one is to
Okay.
precautionary, get a stool test done. The vet will check it out under the microscope and he'll tell you, based on what eggs he sees, which specific worms are there in the pet. These are the
But
two
there are
ways.
no okay, but there are no other external symptoms that a pet will display in case they have worms and everything.
For puppies, the most common symptom, if they've got a very heavy worm load, would be a pot belly. Even though they've
Oh,
eaten a very little quantity, you'll have a nice big round belly. Very common. Another one is after they pass their stool, they do something which we call scooting, which is when they rub
okay.
the bottom on the ground. When they
Yeah.
rub the them on the ground, that's also telling you that most probably your puppy or your dog has got worms. So scooting and worms in the stool. And of course, if you have a very, very heavy worm load, then the lots of minor problems that you would show up: skin problems, indigestion, vomiting. These are all the things. It's a little difficult to pinpoint it from the generalized symptoms, but
Right.
a good deworming schedule is a great thing to do. The biggest reason why that is so is because worms can get transferred from the dog to the human being. Okay.
Oh,
So deworming
okay.
your pet on a regular basis is a great idea, because if you are very close to your pet and you allow your pet to lick you, you could get the worms from the dog into you, and we are not the natural host.
Right.
Worms in dogs are very specific. So then
Hmm.
we are the unnatural host, and the worms migrate all over our system searching for the right environment, which is not available. In fact,
Oh,
somewhere in 1987 or 88, there was a study done by a hospital in Bangalore where they found
yeah.
that 30% of the human population who went to that hospital with seizures had tapeworm cyst in the brain, which
Oh
was
my
coming
God.
from pets, from vegetables which are grown in the ground, and from unhygienic meat. So seizures in
Wow.
humans can be prevented if you ensure that your dog is also dewormed on a regular basis.
Wow. Okay, so that's good to know. I mean, please do, guys, don't take deworming lightly. I'm a little freaked out by this information. I didn't know. I mean, I've been deworming my dogs, but I knew they had, all these problems that can happen with different types of worms. But I didn't know if they transmit to humans, it can be so serious. So, I mean, wow. Okay. And what are the external parasites, Dr. Morton? And, what is the solution for those?
External parasites for dogs and cats,
Yeah.
broadly you can just say there are three. Okay, the
Okay.
first one would be fleas, the second one would be ticks, and the third one would be mites. Not mites,
Okay.
lice. Okay, then
Okay.
look a little further, you can also include the housefly. So what happens with ticks? Ticks, they live off the blood, they stick onto the dog. They're very difficult to get rid of. The
Right.
biggest danger that comes from ticks is they carry germs which cause a disease called tick fever. So tick
Yeah.
fever is not caused by ticks, it's caused by the germs in the ticks. Broadly classified, you could say Babesia, Ehrlichia, Anaplasma. So these are the three different varieties which cause tick fever. They're all blood parasites. Symptoms very similar to dengue in human beings. Platelets drop and you
Yeah.
get anemia because the blood cells are all eaten up. So
Yeah.
that's one ticks. The second one is fleas. Fleas are the intermediate host for the tapeworms in the dog. So if you have a lot of fleas on your dog or cat, possibly they could be also carrying the tapeworm in them.
Oh,
And yeah, lice, not such a bad problem, not so common. Usually find a lot of lice in pets which are close to poultry farms or people who've got a lot of birds, because birds are usually infected with a lot of lice. Okay,
oh,
and then of course
interesting.
the bigger problem would be the regular housefly. So whenever a dog has a moist wound, if a regular
Yes.
housefly sits on that wound, it lays its eggs, it hatches, and then it forms into maggots. So you get a maggot wound, get these big fat worms coming out from the wound. They're just the housefly larvae. That's it. So
Yeah. And
external parasites, these four.
maggots are very painful to treat, right? I mean, for the pet, they just
It's a
dig into the
painful,
skin.
it's a painful problem for the pet, but fairly easy to eliminate. And it's there. You can see it. Fleas, if you've got a long haired dog,
Yes.
you have to search for them. And ticks, of course, your biggest problem would be tick fever. So prevention is good over there. How do you prevent them? They've got different applications that you can use. They've got powders, they've got collars, they've got spot-ons, they've got pills. There's a whole variety. Your vet should be able to guide you which would be the best one depending on the load that you have.
Right. So, Dr. Morton, how does tick fever work? Is it like you said, like symptoms are like dengue, and so it's one infected tick that can cause tick fever, or is it the number of ticks on your dog, or how does that work?
There have been dogs which are covered with ticks. At each
Yeah.
session, you can take out 150, 200 ticks, no tick fever at all. There are some dogs, maybe just one tick. That one tick may carry the germ which causes tick fever. And with one tick on the dog, you can get tick fever. With 100 ticks, may not get it. It all depends on what's in the tick.
So, like a mosquito bite, basically, if a mosquito is a carrier, you will get dengue or chikungunya or malaria, and if the
Yeah.
mosquito is not a carrier, you'll be fine. So,
Yes.
similar.
It works exactly the same way.
Good to know. Thank you for that information. I'll take a question here. Karan is here. Hi, Karan. He's saying, in summer, what kind of precautions can we take for large dogs? Diet, exercise, medicines.
Depends on what summer is. Summer varies from place to place. If you're in a place like Hyderabad or Delhi, then it's pretty difficult. If you're in places like Calcutta or Chennai or Bombay, you got a humidity problem rather than a heat problem. So what
Yes.
do? Try and keep them cool. Don't take them for walks in the daytime. Take them for walks early morning. Take them for walks after the sun goes down. Same thing with the food. Don't feed them in the afternoon. Food in dogs has got a different way of getting metabolized. It generates a lot of heat. So if a
Okay.
dog is fed in the afternoon, he feels very uncomfortable because a lot of heat generated into his system. He has to get rid of that. Then other things you could do is spray them down. If you've got a garden and you've got a hose pipe, spray them down just to cool them down. There's no need to give them a bath. Just spray them down and they'll be cool. Let me see what else he said. Medicines. Summer is a natural phenomenon. I don't think you need a medicine to do something for that. And exercise or diet and exercise, like I said, early morning, late evening. Sometimes
Right.
dogs eat less. Okay, they eat less during summer because they don't need that much of energy. Okay, they're
Yes.
most of the time sitting around, they get exhausted with the heat. What you have to look out for is in places where it is very bad, especially brachycephalic dogs, dogs with a flat nose, like pugs and Pekingese
Yes.
and boxers, they have a very, very high chance of getting something called heat stroke. Heat
Right.
stroke basically is when your dog's body temperature goes up. So that's an emergency situation. You need to rush to the vet. The body
Oh,
temperature needs to be brought down. We normally give them ice baths and uh, water baths and keep them cool. And the success rate with heat stroke is not very great. If a dog's temperature goes beyond 108, chances of your
yeah.
dog surviving is close to zero. So,
Oh,
what
wow.
symptoms do you see? You'll find a dog panting excessively, tongue turning blue, eyes almost bulging out. And if you feel the dog, feel the ears, feel the underbelly, super hot. You need to get it
Okay.
fixed at the earliest.
I'll
That's
take
it.
another question here. Arun, I'm seeing your question, but I cannot put it up before he finishes answering the previous question. So please have some patience. I'm putting it up now.
Okay.
He wants to know, sir, kindly please
Explain
explain
about
about
it.
hip dysplasia in GSTs. What are the methods of treatment from first stage? How can we recover? Please explain.
Hip dysplasia is a genetic condition. Okay. If you are looking at the video, I can give you a small little demo as to how it works. You've got your
Okay.
hip joint and you've got your head of femur sitting in the hip joint like this. Where is it?
Right.
Yeah, this.
Yeah.
So when you've got a good hip joint, you've got a nice cup where your head of femur can rotate nicely. Then you've got
Right.
something called partial hip dysplasia. Partial hip dysplasia is where it is slightly opened. So what happens? It starts to move.
Ah,
When it
okay.
moves like this, it starts to wear out the cartilage, and then you get
Right.
bone rubbing against bone, and then you have full hip dysplasia where there is no hip socket at all, and this hip bone is like going up and down the entire pelvic bone. So this is a
Oh my
genetic
God.
condition. Yeah, in most of the
Okay.
developed countries, they do have an ELISA test where they check the puppies as soon as they are born. And unfortunately,
Yeah.
even though the puppies look great and they look very healthy, they are put to sleep if they have the hip dysplasia gene. How does hip
Yeah.
dysplasia manifest? It comes about only when the dog is almost full grown. 7 to 8 months, you'll be able to see it. The dog finds it difficult to get up from a sitting position, and the old terminology was sway back. So if you look at the dog when it's walking, the whole back sways from side to side. That is hip
Okay.
dysplasia. What do we do for hip dysplasia? What treatments have we got available? What are the options that are available? Hip dysplasia, medicines are there. All the medicines that are available for hip dysplasia does only one thing. It helps to rebuild cartilage. The cartilage that gets worn out due to the rubbing is
Yeah.
rebuilt by the medicines. That's the only thing you can do. If it's an extreme case, then what we do is something called femoral head osteotomy, where you cut off the head of the femur. So there's only the pelvic girdle and the head of the femur which is doing all the damage. The main thing is pain. The head of
Ah,
the femur which is rubbing over there and the cartilage wearing out, that head of femur is cut off. So the muscle
oh,
structure supports the dog. And if it's a well muscled dog, it's great. So it's a permanent solution, normally advised for young dogs who've got like 10, 12 years left ahead of them so
yeah.
that they can live a comfortable life. Otherwise, they'll have to live on a pain medication, pain management medication for the next 10 to 12 years. Not such a great thing to do.
Arun, I don't know where you're located, but if you're in Bangalore, you can contact Dr. Morton at the blueridgevets@gmail.com because I think it's best for such a condition to get a one-on-one view from him instead of asking about it online. Uh, Dr. Morton, I have another question here from Sandeepan. He's saying, which brand of probiotics do you recommend for young puppies?
That's an interesting question. Lots of controversy around surrounding probiotics. Do they work? Do they not work? So probiotics are basically good bacteria which is there in the gut,
Yeah,
mainly strains of lactobacillus. So there is a theory that every single cell in the gut can be colonized by only one bacteria. So there's always a balance in the system. There's a balance of good bacteria and bad bacteria. Whenever we have an upset in the balance and there's more of bad bacteria involved, then you get tummy upsets, loose motion, diarrhea, maybe a bouts of vomiting. So
yeah,
what do? We normally give them antibiotics. The antibiotics clears out everything. Sometimes the
yes.
antibiotics are strong. They even kill off the good bacteria. So you need to put the good bacteria back in. So they have
Okay.
bacteria which is resistant to antibiotics, which is available in the market. They've got veterinary preparations, they've got human preparations. The most common one, common brand name that comes to mind would be Sporlac. Sporlac is the good bacteria which you put back into the system. Home remedy is to use curd. Curd also is full of lactobacillus.
So basically,
Then
if the dog is fine, it doesn't really need to go on a probiotic. Just include a little bit of curd in the diet.
that should most
Yeah.
probably take care of your probiotic problem.
Okay. Thank you for answering that, Dr. Morton. I have a question here from Nidar Shana Rabha. She's asking, what should I do to maintain healthy weight for my dog?
Diet. You follow a balanced diet. You got two options on the diet. One is a home cooked diet, and one is your kibble. So if you're giving
Right.
your dog a kibble, then the kibble is balanced. It's got everything that you need. And if your dog is overweight, then we'll have to look at uh, medicines or foods which can help you to control the weight. They've got medicines which will help you control the weight. There's exercise which will help you to control the weight. And there is specific diets which can help you to control the weight. So what
Okay.
is the healthy weight? A healthy weight is a very difficult question to answer. Every
Yeah.
breed has got a standard. So every standard will tell you my dog should weigh this much. Like for instance, if you say a lab, they say a female lab standard weight, adult dog should be 32 kgs, for a male 35 kgs. But that's a relative term. It's not really hard and fast. You can't really go and say, okay, I want to get my dog to 32. Maybe a 36 kg female dog may be proportionately well built and is not overweight. So I think your vet would be able to guide you better by looking at the dog and tell you, is your dog overweight and what should be done to manage it.
Uh, Hi, Mom. She's asking, what could be a reason a young puppy starts coughing and 2 days later the other litter puppies start to also cough?
Oh, that's an interesting question. Coughing in a young puppy. How young? That's okay. I'll try and answer that question with making a few presumptions. Okay.
Okay.
Young puppy coughing could indicate some respiratory infection. Okay, you have to look at the
Okay.
symptoms. Is it only coughing, or is it also having any nasal discharge? Is the nasal
Right.
discharge normal? Is it yellow? Is it green? Or is it no discharge at all? Respiratory
Okay.
infection can be transmitted from one puppy to the other very, very quickly because their immune system is not developed. So they're
Right.
susceptible to picking up things. There's also a disease called kennel cough, generally not seen in puppies, mostly seen in where there are many dogs mixing with each other. Somebody may have the kennel cough and they pick it up.
Yeah.
It's a bacterial infection. There's a vaccine for it. And most kennels, professionally
Yeah.
run kennels, where you go for boarding, they'll ask for a kennel cough vaccine because it spreads very fast. But
Oh,
regarding
okay.
the puppy, we need to look at what else is there in the puppy to what else is there in the puppy to what other symptoms are there in the puppy, and then we'll be able to figure that out. I
Okay.
hope I
Thank you for
answered easily. Yeah.
yeah. We have a question here from Zintu, who's asking preventive healthcare for Siberian husky. Is AC must for them in summer?
Siberian huskies are very, very hardy dogs. Okay, they adapt very well.
Okay.
Okay,
Okay.
Siberian husky is born and brought up in India.
Yeah.
He's able to adapt. If the weather is very hot, I'm
Yeah.
talking about temperatures hovering around 40,
Yeah.
then he needs to be kept indoors. A good fan or a water cooler should be good enough. If you
Okay.
can, AC also is great. But if you're putting the dog in an AC environment, you must
Yeah.
ensure that take him out only when it is cool. Because taking him out from the AC into the afternoon for a walk, there's a sudden change in temperature from your AC temperature to the temperature outside. It
Yeah.
can make the dog much, much more uncomfortable rather than keeping him comfortable for some time in an AC and then taking him out. So if you're going to keep him in AC, he should be in the AC during the daytime.
Okay. We have another question from my mom-in-law here. She's saying, "What is your view about giving vitamin C to dogs?"
Vitamin C.
Yeah.
Vitamin C is basically a good medicine to promote immunity. And in dogs, apparently, vitamin C is not required too much. I think most of your multivitamin pills, which are available off the counter,
Yeah.
which we give as a kind of preventive to dogs to take care of any vitamin or mineral deficiency, should be able to take care of any deficiency in the dog. Giving additional 500 mg vitamin C to a dog is not going
Yeah.
to help, but it's not going to harm the dog either. All water
Okay.
soluble vitamins are utilized by the body. Wherever there's an excess, it's passed out.
Okay. Makes sense. Thank you. Alok Nanda is here. Hi, Alok. He's saying, which food is better, well balanced fresh food or dry dog food?
For all these years, we lived with well balanced fresh food. The dry dog food came into India maybe around about 1985 86 was when Pedigree was launched, and then the other brands came in.
Yeah.
What is great about the dry food? The great thing about the dry food is just three. Number one, lots of research gone into it, totally balanced, takes care of every single micro ingredient that a dog would need. The
Yeah.
second thing is the convenience. You don't need to go to
Right.
the market and buy something. It's there in the packet. Just take it and give it to your dog, and
Yeah.
the dog will have it. The third thing is well utilized, the amount of poop is less, easy to clean up. Well balanced fresh food is also great. It's all a matter of
Yeah.
what is convenient for you. If you want to take the trouble and prepare a well balanced fresh food diet for your dogs, great. I don't think there's anything wrong with it. You can add supplements
Yeah.
like adding a multivitamin or a multi mineral pill to take care of any minor deficiencies, also is great. My
Right.
dogs, I have two, they get a mix. They get kibble in the morning and they get
Okay.
well balanced food in the night.
What dogs do you have, Dr. Morton?
I have two labs. Unfortunately, they're a little on the overweight side, but I guess that's what labs are. Yeah.
All of us, I think, with labs have this weight issue. Alok, we also did a session on, what is a well-balanced fresh food for your dog. It's on the DogSpot channel, so you can look that up if you would like to see it. I'm going to take another question from Mona Lisa, who's a very regular viewer of ours. Hi, Mona Lisa. She's asking, what is your thought on vaccinating for kennel cough? Some vets are advising this even preemptively. Your advice?
More in Bangalore, I can tell you, in Bangalore, most cases of kennel cough happen only during October, November, December, Jan, during
Okay.
the months which are more colder. Okay. So for my customers, I give them the choice: kennel cough, optional vaccine, defer it. We'll call you if there's an outbreak. If we find lots of dogs coming in with kennel cough, we'll call you and then we'll do the vaccination. But it's not one of the mandatory vaccines on the list.
Okay.
I hope that's clear. Some vets are
And
advising preemptively. I guess,
yeah,
like I said, prevention is better than cure. Don't wait for it to happen. So
right.
there's no harm in giving a vaccine. A vaccine does not harm you at all. It just produces immunity against that particular disease.
I think we have quite a few of your regular patients here who are saying you're amazing and good to see you.
Oh, okay.
So I'll take a question from Ruhi. Hi, Ruhi. She's saying, till what age do we need to give multivitamins and calcium tablets to puppies?
Puppies are growing. They eat for maintenance and they eat for growth.
Yeah.
So supplements should be given till they've reached full growth. Calcium is something that lots of people do not understand. Calcium is something which is not comparable to the requirement for human beings. It is said that the requirement for calcium for a dog is 50 times that of a human being. So giving a
Wow.
calcium pill to a dog every day for the rest of his life is not a problem at all. The multivitamins, I guess, till the puppy grows, it depends on which breed you've got. Some breeds are full grown by 7 months, some breeds are full grown at 2 years. Give
Yeah.
them the multivitamin and calcium tablet during the growth period. Once the growth period is done, I don't think you really need to supplement anything if you're going to give them good food. Good food will have everything in it.
Priya is saying labs are so cute. I agree. I have one. I'm a little biased. So I'm going to come back to the questions, guys. We'll also, I want to talk about a little bit about the preventive medicine, which is a topic for today. And our next point was sterilization. Dr. Morton, what is your thoughts? What are your thoughts on this?
Sterilization is an optional procedure. You
Okay.
have a pet, you want to sterilize, that's your option. Why do we sterilize? We sterilize for 2 or 3 reasons. Male dogs, if you're not going to use them for breeding, if you want to sterilize them, it's an option. It's not mandatory. If you don't want to do it, it's okay. If you have a male dog who is aggressive, sterilization does help to reduce the aggression.
Okay.
If you have many dogs in the house, somebody has to be an alpha dog. If you have more than 1 or 2 male dogs in the house, then looking at sterilizing the male dogs will help to reduce aggression and tension for you with your pets. Okay.
Right.
If you want to sterilize only one male dog out of 2 or 3, it's always good to sterilize not the alpha dog. The alpha dog is still going to be the alpha dog. You have to sterilize the timid ones because then they stop to exude the male hormone smell. So the alpha dog will not go and attack them all the time.
Right.
That's for male dogs. What about female dogs?
Yes.
If you have a female dog, if you're not going to breed her, sterilization is an option. It's not mandatory. It's up to you. You want to sterilize, sterilize. You don't want to sterilize, don't do it. What are the disadvantages with sterilizing a female dog? You have to know the advantages and disadvantages.
Yes.
Disadvantages are 2. It's not 100%. Some of them get it, some of them don't get it. It's difficult to say who's going to get it. You can't say that before the surgery is done. Some dogs, after the surgery, tend to put on a lot of weight. And it's not because of diet, it is because of the change in hormonal structure inside. The second thing is some female dogs tend to have a urinary incontinence problem. But these are the 2 disadvantages, not there in every dog that is sterilized. It's there in some. The
Okay.
percentage is low, but it is still there.
Right.
Okay. What are the advantages of sterilizing? If you have more than one dog at home, you have a male and female, then no puppies. Otherwise, every 6 months you're going to get puppies. It's very difficult to keep them apart.
Yeah.
Number two, dogs which are female dogs which are 6 or 7 years old, good idea to sterilize because chances of problems happening after that are there. Because dogs do not have menopause, they cycle right out through their life. It's there for all
Okay.
animals. So
Okay.
chances of pyometra, which is an infection of the uterus, chances of mammary tumors, chances of ovarian tumors, all these things can be prevented by sterilization. So, if you're very clear cut, you've got a female dog, you don't want to breed her at all, get her
Yeah.
sterilized. It will save you a lot of problem. Once in 6 months, you'll have spotting in the house. There'll be a mess. If the dog sleeps with you on the sofa, on the bed, there's going to be a big mess. You'll have to start using pampers to prevent all this. So, many advantages, some small disadvantages. Disadvantages
Right.
are not 100%, it's there for some, but not for all.
Right. So, what about aggression? What is how to prevent it in dogs, Doctor Morton?
Aggression, you have two types of aggression. One is
Okay.
dominant aggression, where you have a pack of dogs which are having a problem settling down and having one person who's in charge. Then you'll have an aggression problem. Aggression with a single dog is a very difficult one to take care of. Aggression in a single dog in the house usually comes from dogs which have been bred specifically as guard dogs.
Oh. Okay.
Rottweilers, Dobermans, German Shepherds, Pit Bulls. These are all the breeds which will may have this problem. It all depends on your socializing. When you have this dog as a puppy, how you bring them up, how many people they interact with, how free they are with strangers coming into the house and going out. All these things will determine the level of aggression. How do you take care of this? Some dogs, it's very difficult to really do much. If you go to any adoption center, you'll find most of the aggressive dogs that are there, large number, all Rottweilers. Difficult to
Yes.
do anything. Even with sterilization, it does not really help too much. They are built that way.
So, but you feel socializing and training in these breeds specifically would help?
Definitely. We've
Yeah.
got very, very good results. We've got a couple of good trainers here in Bangalore
Yes.
who taken aggressive dogs like this, and their training programs are not restricted to like 2 hours a day. It's an in-house training program for 3 months, and the
Right.
dogs that have gone in there, which are super aggressive, have come out very well socialized and are managed to adapt back to something that we are comfortable with. So it
Right.
can be done. It needs a little bit of investment.
So I'm going to go back to some questions, Dr. Morton, because they're kind of piling up here. Uh,
Okay.
Harleen is asking, I have a 40-day-old pup. He tries to mate every time we touch him. Possible reasons, remedies, or any medication for this?
It's just a bad habit. If it's a 40-day-old pup, it's got nothing to do with sexual behavior. It's just a bad habit. So the best way to clear him up from doing this is to the old method. All you need to correct him. So a good way to do it would be to take a newspaper, roll it up, and it's loud. Give him a couple of whacks and say no. You need to do that periodically, and he'll stop. It's just a bad habit. It's got nothing to do with any kind of sexual intention.
Right. Also, Harleen, there are a lot of videos online where you can check up for training, and also we have on DogSpot a lot of trainers and behaviorists that come on board. So you can get in touch with one of them also for further information on how to train your dog or how to train your puppy. Training is always helps, so I'm a big supporter of training in puppies. Invest the time, with your puppy. Uh, so
List
my
of
mom,
mandatory vaccinations. That's your mum.
yeah, yeah.
Okay. What we advocate is the 9-in-1 or the polyvalent vaccine. There are many brands in the market. 6 weeks is the ideal time to start.
Okay.
Repeat vaccination every 3 weeks. So 6 weeks, 9 weeks, 12 weeks. Once the 12 weeks, 3 shots are done, you need to start. Can you hear the barking? Is it disturbing you? Yeah.
No, is it food time?
Yeah. After that, there is corona and rabies. 2 shots of
Right.
that. So we advocate totally 5 vaccines for a pup. 3 polyvalent vaccines: distemper, hepatitis, parvo, parainfluenza, adenovirus, leptospira. Okay.
Yeah.
6 weeks, 9 weeks, 12 weeks. Rabies, corona, 10 days later, repeat after 3 weeks. This is the vaccine that we follow. Kennel cough, optional, usually towards the colder months. And every year, 1 shot of everything. So 5 shots for a puppy, 2 shots for an adult.
Okay. Indrani, Dr. Morton has already spoken about neutering and spaying, and he's also spoken about health effects in both males and females. So, this live will be on our page. You can come back and just watch it. So, I'm going to take another question and not go there. Dr. Morton, Priyanka wants to know, she says, I understand giving dry food like pedigree and treats on daily basis may be good for short term, but I heard that they're not good for their kidneys in the long run. Is this true? What are your thoughts? I have a German Shepherd.
Simple answer to that question. It's not true.
Right.
Yeah. These companies, see, RC and Pedigree are the same guys. The parent company is called Mars. Okay. The guys who give us the chocolates. They have a wonderful institute in the UK called the Waltham Institute, where they've done research on various combinations for making the best balanced food for dogs. And they spent millions of dollars. I don't think they would have spent that much to give you a food which is going to damage your kidneys. So it's a matter of convenience. That's all. You want to give dry dog food, you want to cook food, it's all up to you. If you're going to do a cooked food diet, talk to your vet. He'll help you to make a good balanced diet. It's only a matter of convenience and how you look at it. Food is food. Okay. Dogs don't need variety, unfortunately, like us.
Yeah.
So that's why they've designed the dry dog food, so that your dog eats the same food, the same taste for the next 10 years. The dog is fine with it.
I mean, I see same level of excitement twice a day. I mean, it hasn't gone down in any number of years that, oh my God, I'm eating the same thing again.
Yeah,
they're as excited. Nalin is asking, I have a French mastiff. I'm giving him Origin large puppy food. Do I need to give vitamin supplements and calcium?
Not required at all. Every dry food, whether it's Origin or Royal Canin or Drools or Smart Heart or Dieback, they all have everything in the right proportion. These are just brands. Right. Yeah, no need for a vitamin supplement or calcium at all.
Okay. And we have, 3 to 4 questions about the same thing. One is from my mom-in-law. Ajay is here. Hi, Ajay. And Priya, they are all asking, what is the best age for sterilization?
Anytime after 6 months should be fine. Some people say we need our dog to go through one cycle. So if it's a female dog, they wait for the first season. After the first season is done, then only they do the sterilization. But I think anytime after 6 months is a good time to start.
Right. Hi, Weasel. And Pankaj is asking, should we be doing regular health checkups like blood tests, etc., even without obvious signs of any health issues as part of preventive health?
It's a great idea to do that, but I think I would recommend it only for dogs which have crossed 7 years of age.
Right.
Unless there are obvious symptoms or any discomfort or any disease that you see that you need to do all these tests. Doing a health checkup for dogs after 7 years helps you to see what's going wrong, what are the early stages of diseases, and how you can prevent it or how you manage it. There are diseases which can be managed, which cannot be cured. There are diseases which can be cured, which can be with medication. So 7 years and above, master health checkup. I'm sure your vet will have a program designed for that, so that you can do a check. Say, I would say Not only the blood test, I would say a blood test, I would say a chest x-ray, an abdominal x-ray. If you want, from there, if you find something going wrong, you can even go on for a ultrasound scan to check if you find something wrong in the x-ray. But otherwise, I
Right.
think post 7 years, blood test, x-ray.
And this is every once a year or twice a year? What do you recommend?
Once every year after 7 years is a good idea to do it. If you
Okay.
find nothing wrong with the first test, then you can do it after 2 years. So let's see,
Okay.
7 years, you do a test, blood
Yeah.
test, chest x-ray, everything clear, no need
Yeah.
to do anything. 9 years, do it again. And then from there, once every year. 7 years, you find something going wrong. 7 years, 8 years, 9 years, once every year, you can do a check to see how things are progressing.
Seema is asking, what are your suggestions for healthy skin and silky shiny hair?
Depends what dog you've got. Yeah. Each dog has got a different requirement. Long haired dog's requirement is different. Supplements
Yeah.
are there. Okay. The
Yeah.
first thing that you need to know is dogs don't sweat. So you don't have to give your dog a bath. People bathe
Mm.
their dogs very often. There are people who've got the white German Spitz, they bathe them 2 times a week, 3 times a week. Makes them look very clean, but you tend to wash off all the natural oils that are coming out from the sebaceous glands, which gives your dog a nice shiny coat. So I would
Yeah.
advocate a bath once a month during cold weather, and during hot weather twice a month. Use a mild shampoo. Don't use medicated shampoos and harsh shampoos. They'll dry out your dog's skin.
Right.
If you're giving a
And
cooked food, ensure that you give a good oil supplement with the cooked food. You'll have a healthy skin and a shiny coat.
she also has another question for you, Dr. Morton. She's asking how to prevent liver and kidney diseases in dogs.
Liver and kidney diseases in dogs comes because of some reasons. So
Hmm.
it could be diet, or it could be predisposing factors. It could be genetic. It's not. There's no vaccine. It's not like a viral disease like distemper
Right.
where you give a vaccine to prevent it. Preventing liver and kidney disease in dogs is very, very difficult and question to answer, because there's no simple answer to that. Okay.
Right.
Liver
Right.
and kidney disease, usually it's a disease of progressive old age, or if there's something wrong with the dog. So I think your vet should be able to guide you on that, rather than making broad statements as, A will
Yeah.
prevent kidney disease, B will prevent liver disease. Doesn't work like that.
Right. Zintu is asking preventive healthcare for female at the time of heat, gestation period, and after.
Preventive healthcare. When the dog is on heat, it all depends on what's going to happen next. Are you going to get her crossed to get puppies, or you're not going to get her crossed? If you're not going to get her crossed, stay away from male dogs, because any accidental thing that happens, there's no quick fix remedy to prevent pregnancy. That's one. Second thing is, at the time of gestation period in dogs usually on an average is 63 days. Your first month, your dog looks perfectly normal. Growth of your puppies inside is very rapid only in the second month. So
Okay.
implantation in the dog takes place around about the 14th day. So till the 14th day after she's been mated, there's nothing inside. There's just fertilized eggs
Oh,
swimming around
okay.
inside. On the 14th day, implantation takes place, and then it starts to grow. It forms a placenta. What do you do during that time? Give your dog a good, healthy diet. Maybe increase your protein content. You need to
Hmm.
start your calcium supplementation in the second month of your pregnancy. Your calcium
Hmm.
supplementation is to take care of three things. Is to take care of bones for the puppies.
Hmm.
It's to take care of calcium in the milk, and it's supposed to take care of the contraction of the uterus at the time of whelping. So
Right.
calcium has to be given right up till the time the puppies are with you. Once the puppies are gone, you can wean her off the calcium. Food during the last 2 weeks of pregnancy, I think you need to give her the same quantity of food, but cut down the portion. So you give her 2 meals a day, you make it 4 meals a day, same quantity, smaller portions. Makes it easy
Okay.
when there's a lot of stuff inside the stomach.
Right.
After and after. After is after the puppies are born.
I
After
guess.
the I guess, okay. After the puppies are born, what do you need to do? Ensure that the doggy, after whelping, has been cleaned well, because the effluents that are going to come out will last for at least about 5 or 6 days. So clean on a regular basis. And if you start to find something going wrong, like a bad smell, then you could possibly be coming in for an infection. Contact your vet. He'll be able to guide you, maybe give you a course of antibiotics, or maybe do a vaginal douche to clean up things.
Okay. Thank you for that detailed answer, Dr. Morton. Seema has another question. She's saying, are lump growths on dogs preventable?
No, they're not preventable. It's only after it comes that we can see it. So once you find a lump on the dog, then you have to find out whether it's a tumor, or whether it's a
Yeah,
cyst, or whether it's a vaccine reaction, or whether it's some parasite which has caused fibrosed material. So cannot prevent it. Only after it's
right.
come, then we'll be able to find out what caused it and whether it can be fixed or whether it has to be surgically removed.
Okay. I'm going to take last few questions, Dr. Morton, because I do want to talk to you about geriatric dogs as well before we leave. So Kanishk is asking, is grass chewing by an adult German Shepherd dog sign of worm infestation or any deficiency? Kindly elaborate.
Lots of dogs love to eat grass. Occasionally they do eat grass. It's a form of cleansing for themselves because the burrs on the leaf blades tend to act as an irritant for the stomach. It cuts the stomach lining inside and the dogs tend to vomit. After some time, some dogs make it into a habit. So whenever they
Yeah,
see grass, when you're taking them for a walk, they'll go and eat grass. It's not a sign of any worm infestation or any deficiency of any sort. It's a form of cleansing for themselves. And if they are periodically exposed to it and if they continue to eat it, then it's just a bad habit that's growing on them. So if you have a dog who's eating grass and he's not vomiting, it's okay. If you have a dog who's going rushing to the grass when you take him for a walk and eating that all the time, then it's becoming a bad habit.
right.
Worm infestation, not necessarily eating grass. There's a whole lot of other things that you could see, but
Yeah.
this does not point to worms or to any deficiency.
And Kanishk, we did discuss the signs of worm infestation at the beginning of the chat. So please go back and replay the video. You'll be able to see that. It's already been answered. Dr. PD Sridhara wants to know, are there any immunity boosters for dogs?
They do have some commercial preparations which are available, immunity boosters. There's one called DMG, and then there's a herbal immunomodulator from Himalaya company called Immunol. How well these work, I don't know. I've not done any. I guess you need to do a scientific study to show that these things actually work. Difficult to say. There's also a product which has come from Spain. I think it's called Viucid, which is also an immunomodulator. So there is no harm in giving it. If you've got an outbreak of any disease, like there's a distemper outbreak or a parvo outbreak, and you've got a puppy coming in for a vaccination, there is no harm in giving an immune booster to the puppy. It will help.
Right. Shauri wants to know, I missed the second dosage of rabies vaccination. Is that an issue? What to do now?
Go and get it done tomorrow. If you missed it on the schedule, I think
Right.
get it done. That will help. Yeah.
Yeah.
How safe is
Ajay, yeah, Bravecto.
how safe is Bravecto to be administered for tick control every 3 to 4 months? Bravecto is an amazing pill. I'm not promoting the brand or the pill, but it's given us all the relief from external parasite and internal parasite problem. Works for ticks, works for fleas, works for ear mites, works for Demodex mange, works for sarcoptic mange, works wonderfully for dogs with maggot wounds.
Oh,
And
okay.
yeah, it's basically an insecticide. It takes care of any kind of insect, including the maggots. And most of the people who bought this pill have complained about the price. And when they've seen the result, they are the guys who complained, who have come back and bought it again. And the packet says 3 months. Most of them have come back only after the fourth or fifth month because it works well. So
Right.
I'd say it's a great medicine. How safe is it? So
Yeah.
far, touch wood, we haven't had any bad reports. Of course, if you go to Google and if you look for bad reports, you'll find bad reports for everything from masala dosas to Bravecto to auto rides. So we have to look at the end point, which is better.
Yeah, true. Sindhu wants to know how can we prevent recurring UTI in male Labradors?
We have to look at what's causing it. Recurring male UTI.
Yeah.
So bladder infection, kidney stones, difficult to say. Need to?
Yeah.
Okay. Basic stuff is, first thing is, change the pH of the urine from acidic to alkaline, bacteria will stop growing. Second thing is, there are cranberry extract pills, cranberry extract syrups which are available, which helps to clear up infections in the urinary bladder. Antibiotics are there. If it's a persistent infection, if it's coming all the time and clearing up and then coming back and clearing up and coming back, then you need to a culture and sensitivity test, find out which antibiotic is doing the best job, and give that to the dog. I think a minimum 3 weeks of antibiotic therapy should help.
Okay. Thank you for answering that, Dr. Morton. Guys, there are a lot of training-related questions here. Please either wait for a behaviorist and trainer to have a live session, or you can go back to our old sessions and look for specific concerns. They've all been addressed. Dr. Morton, before you leave, I want to talk about older dogs and the problems they commonly face, and how can we help our, beloved pets, because as they get older, like everyone else, they need a little bit more help. So if you can touch on that, please.
Geriatric problems. There are so many.
Yeah.
Okay. The most common geriatric problems are arthritis, arthritic
Right.
changes. It starts off with dogs which are finding it difficult to stand, or dogs which are sleeping, they find it difficult to get up, need a little
Yeah.
help. In the beginning, they manage and slowly it deteriorates. Okay, arthritis is a non-curable disease. It's a disease which only can be managed. So there are medicines for that. Regular checks, x-rays will help you to find out how much the disease is progressing and what kinds of medication you can give. In my practice, I have 4 levels of treatment. I would classify in stage 1, stage 2, stage 3, stage 4 arthritis, and we have different medicines which we give for problems like that. That's one. The second most common problem with geriatric dogs is hearing problems and sight problems. Lots of cataract formation. Okay. Whenever a dog has a cataract, okay, as long as the dog is not totally blind and banging into things, they can still see shadows. And if they're not disoriented with a shift in residence, they can manage very, very comfortably. If you want to go one step further, if the dog gets totally blind, then you need to look at doing a cataract surgery. Unfortunately, there's no replacement lens for dogs. Okay. So we just remove the cataract lens and the dog can see shadows with that. So I think it can manage very well with that. And what are your geriatric problems? Your geriatric problems is do periodic blood tests and check. The most common organs that tend to give up as we age are the liver and the kidneys. So monitor that, say maybe once in 6 months, you'll be able to figure out what needs to be done. Medication is there to help clear it up. All old diseases are manageable, not curable. Deafness is another problem.
So, I mean, as the dogs age, like you said, blind, if the furniture is not moved or there's no change in residence, dogs can manage. But what about deafness? How do we communicate with our dogs if they've lost hearing?
Generally, when one system goes out, the other system gets elevated. So, if a dog gets deaf or if a dog goes blind, they compensate with the other system. So, it's either the sense of smell becomes better or they're a little more alert to touch. They can sense gentle touch, strange touch. So, they compensate for themselves. But in terms of what can we do, what we can do is just keep them comfortable. See that they are in the same environment. no changes, it helps them a lot.
And guys, please don't abandon your old dogs. They're part of your family. They've given you all their life, and they to be abandoned at a shelter or on the road at such an age is not a good thing. I mean, the dog is disoriented. They don't know how to fend for themselves there, and they've just lost their whole family. So please, I mean, puppies are great, but I think older dogs are very special too. I feel both my dogs. I have two dogs, Dr. Morton, a German Shepherd and a Lab, and we are so in tune with each other. We know what the other person wants or what the dog wants, and the dog knows what I want out of it. So with the puppy, it takes time to get to know them, for them to know you. But we have such comfort with older dogs. Then both my dogs are over close to 8 years old. So
Okay.
yeah. Thank you so much, Dr. Morton, for your time today. We learned a lot, and thank you for answering all the questions of our viewers. Sorry, guys, for whoever I was not able to take questions. It's been an hour. I have to let him go. But you can join us later, especially for the trainers. We are going to have a trainer soon on our DogSpot channel. You can contact them and speak to them about your training and behavioral issues. And we'll have another vet session soon. And you can look forward to that for getting your questions answered. Thank you, Dr. Morton. Have a good evening.
Thank you very much. I hope I managed to clear up as many doubts as possible. If anybody has anything more to ask, the email is there. They can always check with me on that. Okay. Thank you very much.
All right. Thank you.
Okay.
Thank you so much.